A surgeon in New York State is under investigation for allegedly slapping the buttocks of sedated patients, calling them insulting names when they were in the surgery in the surgical room. In fact, the complaints that have been made against him from folks that he works with who saw this, who witnessed this, said he would slap them so hard he sometimes left red marks or handprints. And that was according to a report by the Federal Center for Medicare and Medicaid Services. The surgeon would slap the buttocks or hips of some sedated patients before operating. 3 staff members told the investigators the doctor called the patients names such as fat, whatever, we don't get to know what specific fat thing he said, while slapping them hard. One staffer described seeing the doctor almost wind up to deliver the slap to a patient. Another said the slaps seemed to be done as a gesture to say, let's get this procedure going. And what I love about
it's like in House of Cards when he wants the cab to leave, he just knocks on it a little bit. It's just like that. Let's go.
Yeah, let's just get that. That's all it was. Perfectly normal thing. And the doctor says that he slapped the patients to test the adequacy of the spinal anesthetic, which when they actually interviewed other people that were in the operating room, the other employees, they said they'd never seen any other doctor do that.
Yeah, they pinch them or something like that.
Yeah, they pinch them or they'll insert a needle and see,
and they don't spank them.
I know.
And call them fat ass.
I think it's kind of gross.
Yeah.
It really.
Well, I mean, again, we were talking about the cops, how you're supposed to be able to respect them. You're kind of on face alone.
Yeah.
You're supposed to be able to trust your doctor, but the thing is, it's a guy, it's a regular guy, and say a woman is out of it because of the drugs that she's been forced to take. A lot of guys, maybe every once in a while, they slip a little bit, and you're putting your trust in those people. And if this guy got caught for spanking, what did the guys who didn't get caught do? I mean, these people were under.
And that's kind of where this really grosses me out, because there was a story recently here in Southern California that one of the hospitals, there was a surgical, it's a nursing, I think it was a nursing assistant, has actually been arrested on sexually assaulting female patients who were under the influence of anesthetics. So, when you're completely vulnerable like that, I think it's a really, really horrible way to for the hospital to not immediately, pull this guy off right away and make sure that he's not doing anything until this investigation is done. Because that erodes the trust that your patients are going to have in your hospital, that you're actually policing your employees to ensure that the patients are safe when they're out cold.
Again, makes you wonder, what is the hospital benefiting from not taking care of this right away?
Yeah.
I mean,
hopefully they will.
Well, this was he went on for a while before this happened.
There's a couple of things about this that I thought were interesting. Now, the staffers that had witnessed this doctor doing this horribly stupid and awful actions, they said that they did not report it because they doubted that anything was going to be done. And also they feared for their jobs because they didn't want to confront him, because he's the big surgeon, so he can get them fired. They're lower ranking employees.
Yeah.
And that's a scary thought as well. If you've got this kind of culture in your hospital, which possibly is throughout other hospitals as well, where your surgeons are so much higher up and everybody else is in fear of losing their jobs that they don't report things like this.